Yes. Hello everybody, today I'm with Benedetta.
Hi.
And Eduardo, my assistant.
Hello.
We will talk about scoliosis. So, this is the spine, and with scoliosis we have three important curves that you can see. So we will start with the lumbar, so the green, and then the dorsal, the blue, and the cervical is the purple. When we have this kind of condition, we will start to talk about an important pathology that is scoliosis. So, let's see together the assessment and the treatment. We start with a view of the patient on the front side, and it's very important to check the line of the shoulders and the line of the hips. So let's check the pelvis to find any rotation of the ribs, for example in this case, and it's very important to give a look to the triangle we have between the arm and the side. Another important assessment, you can drop your head and your arms a little bit more. Yes, perfect. And I will try to find right here any rotation of the ribs cage. We'll check the lumbar rotation or inclination, because with scoliosis you can find here, because let's make together the flexion, yes, the rotation and the side bending. When we put together all these parameters, we start to have the modification of the curve. It's very important to bend forward and give a look to the muscles, because on this side we will have an hypertrophy muscle and it will start to stretch more on this side. Here we will have a stretched muscle, so this is longer than the other one, so we have a different length comparing the two muscles. Then with Eduardo we will show you some important exercises too. Yes, and we start down of the bone a little more. Yes, okay, we have here, right here. Okay,
93.
so it's 92, yes, 93.
93.
Okay, let's check the other side. Same protocol, so we will start from the hip right here, and then we go downward. Yes, the fibula
89.
89, so we have an important difference comparing. It could mean
4 centimeters.
something about
4 centimeters.
4 centimeters, it's a lot. We have to check now if it's something about the real length of the legs, or maybe something caused of the hip, because if I put a rotation of the hip forward, I will make longer the leg. If I make a rotation, in this case backward, I will make shorter. So you can see rotation and backward rotation. It's very important to see if something that is linked with the pelvis. In this case, I make a comparison of the, yes, and I'm going to compare the iliac bone, and you can see that something is caused of the, you can see the difference. Look, this one is going downward and this backward. So I will start to have all the notions to start my treatment. When we have the scoliosis, we will treat for the first step the hip. So we start to prepare an important base of our body. Then we will work correcting the hip, then lumbar fulcrum, dorsal fulcrum, cervical fulcrum, and just for the last, the occiput with the Atlantis. So it's very important to check all the sides. So relax. Okay. Please, Eduardo, hold there. Yes, hold on tight, please. Okay. Relax. Okay. Make the decomptation. I'm going. Okay, let's go. Yes. Wonderful. Don't worry. Stay with us. Okay. And now let's approach the iliac bone. Perfect. Relax. Good. Take a breath. Okay. Exhale. Good. Good. This one is an important, it's a very tough approach, because the pelvis and the hip. When we approach the pelvis on this side, it's important to approach the compensation on the opposite side. The compensation is right here. This is the fulcrum. Eduardo, please show the fulcrum, because we are in a very important spot, you can see, on the L2. So we are starting to treat fulcrum between the last dorsal and the first lumbar vertebra.
Yes.
Right here. Okay, we are ready. So, breathe in, okay, and breathe out. Relax. Good, perfect. So relax. Good, wonderful. Now, take a moment to rest. When I approach the scoliosis, I will have always one side making the issue, the compensation on the other side, and then the spine trying to compensate again on the other side. So I will approach this side and then again on the other side. So in this case, I have to approach the opposite side of the last one. And I will just test with my fingers the right spot. So not this one, not this one, this one. And I can test moving the rib cage, and the problem is right here. This is the fulcrum. Okay, so now lie on your back. Okay, please put down the legs. Okay, now take a little breath. Yes, exhale. Relax, relax, relax. Don't worry, don't worry. Yes. Are you okay?
Yeah, I'm fine.
Don't worry, it's normal. Good. Yes, this one was a little bit difficult to receive like technique, because the dorsal generally make a very important curve, and with Benedetta was the main curve, so the main compensation. So it wasn't easy. Very good. Once again, we solved iliac bone, then the lumbar, then the dorsal, and now we are right here. And now we have to check together the last fulcrum, because here we have the spinous process, so we are checking together. Oh, this is very interesting. Yes, this is the fulcrum. Let me be sure. Yes, I'm sure. Okay. Now, relax. Perfect. Drop your head. Just your head. No, drop your head. Don't worry. Perfect. I'm right here. You can see. Okay. 3, 2, 1. Relax. Good. Wait a moment. Second part. Okay. No, relax your. Just drop your head. Don't worry. More relaxed. More relaxed. More relaxed. Good. Wonderful. Yes. Release the muscles. Good. More relaxed. More relaxed. Okay. Yes. And now, last part. When you have the scoliosis, sometimes you start to wrong position of your vertebra and your spine, but never of your head. You never seen someone walking like this. It's very uncommon to walk like this. So it's very important to have a straight position of the head. And to do that, we have to solve an issue about the occiput. More relaxed, more relaxed. Yes, perfect. We are going. Yes. Other side, don't worry. Take a moment to rest. Okay. More relaxed. Okay. No, more relaxed. Okay. Enough. That's what we are going to do in a case of scoliosis. It's very important to remind that scoliosis can be fixed about 10 degrees, 20 degrees. When you are going toward the 30 degrees, it starts to be a severe scoliosis. About 40 and 50 degrees, maybe it's a case that needs surgery. So it's a very not simple, and it's not an easy matter. But that's what I do to approach the structural functions and structural points of the scoliosis. The second part is very interesting because I work with my physiotherapists. So let's show just one approach, for example, for the muscle.
The lumbar muscle.
Yes, Eduardo chose this side because you remember I showed you in the test that this was the short muscle,
exactly.
So it was very stiff. And now we are going to make a stretching for this muscle. I will show you. Yes, you have time, don't worry, no hurry. Okay, and we start to stretch. the muscle. So I will take the spine just to show you. Yes, relax is a massive stretching, because Benedetti is an athlete, but with another patient we will go a little more delicate, don't worry. But we're going to make the open and stretching the muscle on this side, because we are making far one better with the other one. Yes, thank you. Another exercise could be this test. You remember the forward, the bending exercise? Yes, forward. So bend forward. Okay. Drop your head. Perfect. And in this case, with 2 minutes of exercise, we are going to stretch the muscles. It could be very interesting. 3 minutes. If you want to try this at home, it could be a very good idea. You can use this mainly in the evening, after sport. Would be a good warm-up for sport, for example. And then it's very important when you finish the exercise to bend your knees, okay, and your back slowly, protecting the low back. So you can clearly see that we reduced a lot, and it's just the first treatment. We reduce a lot this first rotation. Nothing here, so it's very good. Okay. Let's check together the hips. So in this case is the iliac bone. In this case this is came backwards, so I would like to test this one before. Yeah. Okay, let's go. This was, how much was this?
89.
Okay, so let's go again.
93.
94.
Yeah.
Wait. Let's be sure.
It's not.
Yes, 93. 93 and something else, and enough. Good, so we recovered a lot. So it means that Benedetta has the same length of both legs. So it was just a problem of the hip, iliac bone. We saw some exercises, we saw the assessment, we saw the treatment, and now let's see the most important advice. Let's show to our friends what happened at school, for example. When children stay in this position, they start to write, and then they stay very comfortable on this side. In this case, for 5 hours and more, we will start to make an important rotation. So look what happened to our spine. Thank you. The problem is that if you try to do the opposite rotation, we will find an important stiffness on this side, and it will be difficult to breathe, because we will have the lungs meshed inside the posture, because it's not common and not comfortable for us. So the child will always do the same mistakes. This. And in 6 months we can make a real scoliosis. To avoid this and to correct this and to stop the main causes of scoliosis, it's very important to touch with the stomach. Yes, a little more, okay. And find a straight chair, and then you can write with no problem. In this case, this chair is not good, so I will make a little more, yes, straight like this. And this starts to prevent the scoliosis, but also to correct the scoliosis. For example, at school, or at home, or in our office, okay? The second important suggestion is about the coach. So you are watching a beautiful series on the television, and then after a few minutes on the sofa, you start to slipping down. So you start to slide down like this. And it's very common. You will feel pain on the low back, but mainly you will start to make an important and not physiological curve of the spine. So a pathological curve. In this case, it's very important to lean back again, so come a little backward, okay, and find, in this case we have this little, we can find a little chair, a stool, a puff, just to make 90 degrees under the legs. And it will be very good because it will stop you slip down, so it's very important to break. Yes, and stop your posture like this, because it's very comfortable watching the television. In this case, it's impossible to increase the scoliosis because it's a very clean posture. So remember, the first cause of scoliosis is the posture, and it starts when you are sitting in a wrong position. So correct the sitting position while you are studying or working, and correct the position where you are chilling out, just relaxing, and you will see that you will stop your scoliosis. It's very important. So it's my personal suggestion for you. We hope we were useful for you. If you have any questions or comments, you can write below. And thanks Eduardo, thanks Benedetta. Let's say goodbye to our friends. Bye bye. See you.
Bye bye.